The SHA claims processing has several stages, about 10 stages, which include pre-authorization, under review, under technical review, returned, rejected, approved, loaded to pay, paid, EFT, and then stages of the past, then closed. There are roughly 10 stages. This mimics the lengthy bureaucratic stages of the past NHIF system that was intended to be cured under SHA. Clinical review claims can be stagnated for up to 5 months or more based on our experience to date, and this is an area that requires much improvement. We demand that we reduce SHA claims processing stages and resolve all claims within 14 days from invoice claim date. Matakwa ni kwamba tunahitaji hospitali zetu zilipwe. Tumepeana huduma, lakini malipo ambayo tumepata ni nadra sana. Kwa hivyo tunataka hospitali zetu zilipwe. Ukiangalia mambo ya NHIF, haya ni madeni ambayo yamekuweko kwa muda zaidi. Na kwa hivyo wakati ambapo rais anasema hospitali ambazo zinatakana zishughulikiwe kwa haraka ni zile ambazo ziko na 10 million and below, tunaona ya kwamba itakuwa vigumu, kwa sababu hospitali kama Tenwek, hospitali kama Kijabe, kama Kikuyu, kama Mata ni hospitali ambazo kazi ambayo inafanya ni ya juu zaidi, na kwa hivyo NHIF iko na pesa yao nyingi, na hivyo itakuwa ugumu sana kwao. Tungependa serikali iangalie katika mambo hayo, na kwa hivyo kusawazisha, ili angalau kila hospitali ifanye nini? Ishughulikiwe, na pia hilo deni kwa sababu limekaa kwa muda liweze kushughulikiwa kwa haraka. Na jinsi ambavyo Bishop Norman amesema ya kwamba kama kuna ugumu na fedha katika nchi ya Kenya, itakuwa vizuri wa Kenya kujulishwa kwamba serikali iko na changamoto ya pesa, ili watu wasaidiane na serikali katika kubeba mzigo huu. Asanteni.
The Kenya faith-based health services providers are issuing a 14 days ultimatum demanding for immediate payment of outstanding NHIF, SHA, and Makel debts totaling to 10 billion. NHIF 6.8 billion, SHA 2.2 billion, and Makel 1 billion. We will be forced to suspend offering services to beneficiaries of the said scheme and offer the services to them on cash basis.
Does anyone in government have any doubt on the veracity, the truthfulness of the claims from the faith-based facilities? If so, why has it taken months? Why is our system so bureaucratic, and why are we bringing in the whole system of verification for faith-based at this end? Some of these facilities are offering the only places, like in the facility at Tenwek, we do from this year more than 75% of open heart surgeries for this republic. That means that require millions and millions of support through SHA. I would like to say this has to be done as it has been recommended, that if it will not happen within the next 14 days, it is forcing the faith-based facilities to not to down the tools, but anybody coming in to come in cash.
It has taken us a very long, painful time. We've met who can be met in this country. And I mean who can be met. We have met the CSEs over the time as these debts were accumulating. And you know, we have all been treated to this. We are going to pay you A, B, C, D. Time goes on, and I think now we've been understanding, and we have come to this decision. Let the government come out and clear it in 21 days. As it has been put, we still continue offering services to our clients, very painfully turning away others. But what do we do? And this has been consistent, even as late as today. I looked at the front page of the Standard. I don't want to repeat what was there. I also looked at the Nation, what was there, and that is it. We are saying, you know, there is something seriously wrong in the system. And thank you for standing with us, because we are fighting for the same wananchi. Creditors are at our doors asking for money. Our workers are there, and it has become a very painful experience for us. And so my one conclusion is that, okay, whatever system the government has put in place in SHA, NHIF, and the others, it's a government business. And our appeal, what we are seeing is that the government is not either willing to pay us for whatever reasons, and put on these lengthy, I called it structured delaying process of endless checking and counter-checking and then stopping and all that. To me, that seems to be a way of delaying or even refusing to pay our claims. Finally, you know, we feel hurt, and it's painful that the very people we defend the poor, we have to make this unfortunate decision that we can turn them away. And it's simply because we are not able. It's like a mother abandoning a child. We are not able to absorb any more debts. We are saturated. We have reached the saturation point in this matter.
The scheme for teachers, police, and prisons, funded by government at approximately Kenya shillings 20 billion, now 10 years and counting with the same vendor. FBO hospitals on Makel medical scheme have not been paid for the period since July 2024 to date. And for some hospitals, even more months. With a very complicated process of payment, intimidation of hospitals, unfair business practices, and apparent conflict of interest, where specific hospitals are favored in payment and contract terms.
Yes, SHA has been paying claims, but from our records, what they have paid is about 50% of the total claims that faith-based have made. In our statement, we did indicate that by the end of January, we had received about 2.1 billion shillings.
It has never come to a place that is unprecedented in this republic, where the faith-based facilities that are offering nearly 50% of the republic's health provision, and that are a critical pillar to support the national universal health coverage for this republic, they have never come to a place of this crisis, where services are being cut down and where a number of them are facing imminent closure. The church is not in war with government. When you have a critical component of health coverage in the nation, 40% of entities that are not supported by taxpayers' money not being given their dues, it is unfair.
SHA system has no reconciliation function for claims inherited from November 2023 to September 2024. We recommend that SHA to provide a transparent portal dashboard for invoice tracking that can be downloaded for review by hospitals. NHIF had good reconciliation reports. Provide access to that portal to resolve this portion of transition reconciliations. Hospitals are unable to get adequate help from SHA regional offices. They seem not to have been trained or empowered to make any decisions. They always refer all questions and support requests to the system developer, who appears to be outside of SHA, unreachable and with all authority. This is collaborated by the media reports, quoting the Government Auditor General, that the vendor of 104 billion digital superhighway owns the system, the data, the reports, and makes far-reaching decisions. We recommend that SHA staff should be empowered with the necessary capacity and access to manage the SHA system for efficient services to clients and service providers.